Hello and welcome back. It's Dr. Ruth here again. So today I'll be talking about sickle cell. In a previous video I talked about sickle cell anemia. Still again reiterating the fact, simply because recently I have seen patients, and I'm talking about children right now because I'm currently undergoing pediatrics posting, so all I see is children. So recently I've seen children, and it is more hurtful and painful when you see innocent children that do not deserve this, did not ask for this, do not know anything about this, having to deal with the pain of sickle cell. I had a patient whom has been on admission for, I think was on admission for like 3 weeks, and the father at this point got tired because the mother was the one staying with the child. He's a 3-year-old boy. The mother was the one staying with the child in the hospital, and she too, you could see that she was tired. But of course, the mother would not abandon her child. Now, the father comes once in a while. And then the father told me one day, he said he wanted to talk to me. So I came into the room to tell them, okay, these are the medications for your child. And he said he wanted to talk to me. I said, okay, fine, let's speak. So I went outside and he told me that he wants them to go home. And I told him, the situation of your boy is not one to go home. So now the boy had septic arthritis as a result of the sickle cell. Sickle cell comes with a lot of complications. Children can even have stroke as a result. Now, this boy had septic arthritis and the boy was in pain. He was always crying. For every time I entered the ward, when I hear him, I know he's the one. Like, I knew his cry because he was always in pain. And the father said he wanted to go home. And I said, how can you go home with such a boy? He's in pain, he's not stable. And at that point, all I could hear him saying was like, we just want to take him home and keep him. So it's like anything that happens, you get. So it felt like if the child is going to die, okay, maybe let him die, we may have peace. Or if he lives, well, good and fine. So it was really sad. I had to talk with the father, and the mother said she didn't want them to go home because the child wasn't well. So eventually the father, because he told me that this was causing problems between him and his wife, and she also told me that the husband has not been coming to the hospital, and for every time she asks for money for medications, he's always complaining. So he insisted on going home. Well, haven't spoken with him. Eventually the wife's brother came and he asked me what was going on, and we discussed alongside the father. So he persuaded them, and I believe decided he was going to pay for some of the bills. And so they stayed back for some days. But even towards the end, the boy wasn't getting his medications as he should. So there was really no reason keeping them. And eventually they decided to leave. Now, this is a child that didn't ask to be born. And I'm talking about parents we're not talking about parents that were born in the 60s, born in the 50s. I'm talking about parents that are millennials. You see it. And I don't know how you can live with yourself. Even have one currently spent over a month in the hospital. Same thing. Has septic arthritis, has some problems with his liver. A lot of things are wrong. Every day it is one thing or the other. But recently the patient has gotten stable. But this is just to say there's a lot of pain that comes with sickle cell. And when I'm talking about pain here, I'm talking about both physical and emotional pain. Now, pain not only for the child, but even the parents. I've seen where parents are tired. It's causing problems amongst them because of the child. You spend good man hours in the hospital. You spend your whole day basically. Like this one I'm talking about that has spent over a month in the hospital. Both mother and father are in the hospital with this child day and night. Sometimes the father goes home and comes back, and not forgetting, this is not their only child. I think they have 3 other children or so. This is like the last child. So you can imagine what the other children are going through, the neglect for the other children, simply because there's a child who is constantly sick. And there's no guarantee that when this child gets stable and we discharge from the hospital, that they won't be back in a month's time or 2 months' time. So it's a painful experience. It's not something anybody wants to experience. And I know sometimes it's easy. In short, I used to be an advocate of, okay, if you love yourselves, well, go ahead, get married, but do not involve another person in it, meaning do not give birth. But often than not, again, I hear people talk about how their contraceptive fails and they got pregnant when they didn't plan to. So imagine you got married and told yourselves, oh, we are not going to have kids, and then you are on contraception and then your contraceptive fails. So what do you do? And then you now get pregnant and you give birth to a child who is now a sickle cell warrior. What do you do? So entirely premarital counseling. In short, these days it is even advocated that beyond premarital counseling, at early ages, children should be screened for this thing, so that you already know your genotype. It's not when you're about to marry or when you're falling in love with somebody, then you are realizing that, oh, we are both AS and it can't work. And for some people, once emotionally invested, it's really hard to take them aback. So more than anything, I will come back here once in a while with constant reminders, because this is not something to be played with, and it's something that can be avoided. That is the most annoying part of all this. It is avoidable. So when you keep seeing people again and again and again, and you are wondering wherein lies the problem, is it the education that is not properly done? Is it that people are still unaware? Yes, I'm very sure that when we go to especially rural areas, the awareness is still, there's still paucity of knowledge about this thing. So once in a while, we'll still talk about it, and do well to share this video to as many people as you possibly can, just so that people are aware that there's something that hurts both the child and the parents, all in the name of love. But eventually what you call love will put you in trouble. Thank you for listening. Bye for now.